Hello, it's Monday, October 17th, 2022. This is Dr. Rhonda Johnson, and today I am talking about an increase in respiratory illness in children. Now, folks, more and more babies, toddlers, and children are getting sick and ending up in crowded doctor's offices and emergency rooms in various parts of the country. Some children's hospitals are at bed capacity. So what is going on? Well, it's a combination of viruses known to cause respiratory diseases in children. Parainfluenza, influenza, RSV, otherwise known as respiratory syncytial virus, rhinovirus, and enteroviruses. And folks, we cannot forget there's a lot of COVID variants out there. Well, on September 9th, the CDC issued a health advisory because during August of this year, there were significant increases in pediatric hospitalizations in patients with severe respiratory disease who tested positive for rhinovirus and or enterovirus. Now, many children are testing positive for enterovirus D68. Now, I'll shorthand that. EVD68, enterovirus D68, can cause serious acute respiratory illness in children, and it's been associated with a condition called acute flaccid myelitis, a rare but serious neurological complication involving weakness of the limbs. Now, common symptoms of children who have been hospitalized with EVD68 include cough, shortness of breath, and wheezing, and fever is reported in approximately half of the cases. The bottom line and the key takeaway is that experts say this year the respiratory virus season has started sooner for children and that the numbers are unusually high. So what should parents watch out for? Symptoms of the common cold, such as runny nose and cough. But if you see your child getting worse with difficulty breathing, severe coughing, breathing hard with the chest and the ribs moving inward, constantly throwing up, or unable to drink or eat, and of course the sudden onset of limb weakness, call your child's doctor or get to the nearest emergency room. Or if you're unable to have transportation, call 911. That's my message today. Now, what can you do to prevent this? Well, again, avoid touching your eyes, nose, and mouth. Wash your hands often. Avoid close contact with people who are sick. Cover your coughs and sneezes with a tissue, not your hand, and stay home when you're sick. And wear a mask around other people if you have respiratory symptoms. Okay, folks, I hope this is helpful. I hope your children stay well this respiratory season.